Hi, I'm Dr. Jeff Cummings with Tahoe Orthopedics and Sports Medicine here with your Barton Health Peak. The injuries that occur that we see most frequent in the shoulders, fractures, dislocations, or soft tissue injuries, i.e. rotator cuff tears. The fractures we see with snowboarding and particularly mountain biking, we'll see clavicle fractures, we'll see AC separations where we actually separate the clavicle from the scapula. There's also the glenohumeral dislocations where you actually dislocate the ball from the socket. Then the rotator cuff tears, that's another issue where it's more of a soft tissue problem where you've torn the rotator cuff, the muscle belly, the tendon that attaches to the bone. When it's a fracture or dislocation, it's pretty apparent when it happens. You know something's broken, something's not right. You have swelling, you're feeling it. If it's dislocating, you're not moving your arm. You obviously have deformity, crunching of the joint. It's just not feeling right. So usually that'll prompt emergent care or urgent care situation. Get an X-ray, see what's going on. If it's a rotator cuff tear, it can be just pain that'll gradually settle down, possibly over 6-8 weeks, where the pain's pretty acute, but then you'll have difficulty with strength and resistance and night pain. Night pain is a very common thing we hear complained about. So surgical options for patients depends on what it is, depends on the fracture care. A lot of times you're looking at getting plates and screws in there to get the bones lined up in a proximity so they'll heal. Sometimes it may be a rod. For soft tissue injuries, dislocations, if it's an AC dislocation and that we're having to reconstruct that AC joint, so we're suspending it, the clavicle down with the scapula. If it's a dislocation, we're usually repairing the labrum, that is what rips off the glenoid. Same thing with the rotator cuff, it's a soft tissue repair to bone, so we're using anchors and stitches to repair that. The recovery for all of them, unfortunately, you're in a sling for a while. Let these things heal, but then we get our therapist to get you going, usually 4-6 weeks down the road, get that motion back and recover. Other issues with shoulders that people develop, not so much necessarily from trauma, is arthritis, various arthritis of the shoulder. Usually we'll start either way, conservative with therapy, anti-inflammatory medications, activity modifications, various injections, typically cortisone injections. If all that fails and you realize your function is what deteriorates, usually the first thing we'll start seeing is loss of range of motion. Somebody with early arthritis, you'll start losing range. You just won't have that range of motion. The big thing that people complain about, they can't reach overhead. They're trying and they just can't even get up overhead, have a hard time getting things out of their cabinets, putting the cups away, the dishes away. When the patients come to us and say, I'm done, I'm ready for surgery, it's a major surgery. It's a joint replacement we're dealing with, so it's nothing to take lightly, but the outcomes are fantastic. For more information, visit bartonhealth.org.